A new initiative from Health and Human Services seeks to prevent preventable health problems in what it calls underserved communities. The HEROES program will run through the Advanced Research Projects Agency for Health, ARPA-H. HEROES stands for Healthcare Rewards to Achieve Improved Outcomes. Here with how it will all work, the program manager, Dr. Darshak Sanghavi. Dr. Sanghavi, good to have you with us.
Nice to be here. Thanks for having me on.
And I want to read a sentence from the description of this program. HEROES aims to trial and validate a radically different approach to creating preventive health care incentives in the health market. What does that mean?
I've been a physician for almost 20 years now, and I'm really proud of the work I do and many of my colleagues. But think about how we give healthcare in this country. We wait until people have symptoms or some kind of problem. You go see the doctor. The doctor does something, perhaps they'll, give you medications or diagnose you at that point. The bottom line is it's a very reactive system. And the reason it's that way is because it's the way we pay for care. You only get paid when you actually go out there, you seek out that care, and it's often given in clinics or even in much more acute settings. Now, if there's one thing we've learned in healthcare, it's that we get what we pay for. As a physician, I know I care an enormous amount about my patients, but it's inevitable that the incentives that are set up also change the ways in which we give care. So broadly speaking, if you think about care in our country, we should be really proud of the care we give. The challenge is that it's really weighted towards acute, sort of high-intensity care when people are already having problems. You think about the fact that we don't have great prenatal care, and yet when women sort of get critically ill, that's when the system springs into action. We don't do a great job with sort of thinking about, well, how are we going to prevent heart disease and stroke? But the minute you have that, you get access to some of the greatest care around. What our program wants to do is to sort of flip those incentives on their heads. And so we want to create a system where innovating around prevention, it's not only the right thing to do, but it also becomes the smart thing to do.
And you mentioned in the program, that is, the underserved communities, because there's lots of great preventive care if you're in Upper Manhattan, if you're in the canyons of Rodeo Drive, the affluent areas of the country. There are health plans that pay for preventive medicine. You get covered for a couple of annual visits to checkup and so forth. Yes. Not the case for those that don't have access to that type of plan.
There's certainly an incredibly important sort of trend we've seen is that when you look at where you live, your zip code and your income often determines how long you're going to live and how healthy you are. There's no reason that should be the case, but it has to do with the ways in which we've set up the system. So you're absolutely right that part of our program and what we're trying to do is to create an incentive and a way in which we care for Americans that doesn't depend as much on those things of like where you live and how much money you happen to make, and to create that sort of accountability so that we truly create better health outcomes for everybody.
All right. And how will the program, the HEROES program, actually go about doing this?
So the key innovation is that maybe sort of using sort of the terms of business and economics, we are going to create an incentive to actually buy outcomes at geographic scale. Now, what does that really mean? Well, think about it this way. Let's take one of the potential outcomes we'll look at, which is the rate of opioid overdoses. We know that opioids are a major crisis, one of the leading causes of death for young people in the United States. And think about what we do now. We wait till sort of people have overdoses. You kind of go out there, you treat them, but we don't do a great job. Only 25% of individuals, even after they have an overdose and go to an emergency room, think about that. You've actually overdosed. They brought you to the ER. Only 25% of them actually get evidence-based care to actually develop a long-term path to recovery. And why is that? Well, that's because nobody is accountable for that entire community. So the HEROES program, for example, we're going to do this for 4 outcomes and get comment on that initially. But what we're going to do is an organization could say, look, we're going to take this area. Literally, they're going to draw a line around a population. So they'll say these 500,000 people or more, I'm going to be responsible for their rates of opioid overdoses. Doesn't matter who you are, where you live, who your insurer is, but you'll be responsible for them. We at ARPA-H then, this is the magic. We will then actually create a payment program to say, well, if you can lower the rate of overdoses, and we're going to measure it, almost in real time, you get paid for that, for the entire population. So in other words, for the first time for a whole population, we create a business case and incentive to buy that outcome. Now, what that'll do is then it'll create an incentive for kind of innovation. Well, how are we going to get to that whole population? Are we going to get to the community? Are we going to move outside the clinic? All the kinds of things that our innovators can do to then truly address the needs of that whole population.
We are speaking with Dr. Darshak Sanghavi. He's a program manager at ARPA-H. And what types of organizations will be eligible to do this? Because, frankly, it sounds ambitious.
Well, we need all the help and creativity we can get. So what we're looking for is we want to move outside just the traditional types of healthcare deliverers, doctors, clinics, nurses, physical therapists. So these can be larger provider systems. It can be early stage technology or startup companies. They can be nonprofits. And in the best case scenario, we would get consortia where they would sort of voluntarily come together and apply as a team, because this really is a team sport. We also want to unlock sort of the private sector's ability to truly innovate here. So our only recommendation is that the primary applicant, what we call health accelerators, can't be a federal or state agency as the primary.
What types of incentives are available? Do these organizations or consortia get hundreds of thousands, millions, billions? I mean, how much money is behind all of this?
So what we're doing is we have used our, modeling, and we've kind of looked at our data. And what we've done is we've set targets that we believe will generate realistically about $60 million of societal value in each of these areas. So, for example, we've set a target. If you choose, say, severe obstetrical complications, we all talk about maternal mortality. We believe that we can reduce that by about 20% in an area, and that'll generate $60 million of value. And that's a lot of value for people. And it's not just money, but behind that are real lives. So we will pre-purchase in each region $15 million. And because we want to make this sustainable, we are going to preference areas where others also step up to supplement us. Like, for example, healthcare payers, philanthropy, employers, everybody who benefits at about a 2-to-1 match. That's what we're shooting for. And so it'll be about a $45 million pot of money that can be earned. So that's sort of the incentive for organizations to hit those metrics.
And what is the baseline time period? Because if you're going to say reduce fentanyl deaths or reduce obstetric complications, how do you measure that and over what period of time?
Yeah, this will be the year where we're going to sort of have people apply, and then the performance period will be starting in the first quarter of next year. And it's going to be a 3-year program. We actually believe that these are all urgent issues. And most importantly, we already know what to do around, say, opioid overdoses or obstetrical complications. It is not a mystery. So what we'd like to do is to truly create that incentive for rapid improvements. As I said, 25% of people are getting evidence-based care. We don't need to wait 3 years to get people into better care. An enormous number of women, when they're hospitalized for childbirth, they're exposed to a system that's not doing the things that need to be done to prevent complications. Again, we know what to do. We don't need to wait as long. So our hope is that by creating this incentive, we'll accelerate the adoption of that innovation in a way that's truly accountable.
And you mentioned there are 4 areas. Where are they?
So the 4 areas are, and we chose these because we want this to be an American program. We want there to be something in here for almost every age group and every geography. So we intentionally chose outcomes that sort of span that. So those are, as I mentioned, severe obstetrical complications, obviously a big issue. Mentioned opioid overdoses. Affects generally younger people, a certain geographic distribution, and then risk of heart attack and stroke, slightly older population, and finally, alcohol-related health harms. So those are the 4 outcomes. What we're doing right now, and this very moment, people can go online and let us know which of those outcomes they're most interested in pursuing. We've put all 4 out there. We're going to collect sort of feedback. And the initial program is going to sort of really zero in on two of those outcomes. And then we will potentially add other outcomes in the future. But we want people's feedback about where they think the energy really is.
And how will you choose the geographical areas?